Thank you for joining us today for this webinar about school-based community health workers and how they meet student needs. I'm Christy Gagne, a manager for the Telehealth Rocks program. Telehealth Rocks is a federally funded program that focuses on school-based behavioral health, and we do this by working on a number of things like social determinants, supporting school-based services, and telemetry trainings just like this one. We've got just a couple of notes for you. This session is being recorded and we will send it to you afterwards. Your microphone has been muted, but please feel free to use the chat to ask questions or make comments or to unmute. And then please do type your first and last name either in the chat to say hello or make sure that it's visible on your Zoom screen so that we can track attendance. We have no disclosures and everything presented today is evidence-based. And then after the session, the slides and recording will be shared with you as soon as we can. Please give us just a little bit of time to process the recording. We will mail certificates of attendance. Those will be emailed to you after the session. And then please feel free to send any questions you have to our Telehealth Rocks email. With that, I'll hand it over to Robert Stiles.
Good morning. I am Program Director for Telehealth Rocks, and I am so pleased to have Megan Opie and Aaron Brinson, two people from the Eldon School District that I have known for a very long time now. I used to work in Missouri and began working with them there, and really excited to hear about Eldon, which piloted school-based community health workers going on 7 years ago now, and has really got an active and awesome program and have a lot that will be, I think, really beneficial for other districts and communities when they think about why a school-based community health worker might make sense in their community. Next slide, please. So just as sort of an introduction, we'll talk a little bit about why would you want to have a school-based community health worker in your district or community, and then I'll hand off to the Eldon folks, and they'll talk about Eldon overall and what is a school-based community health worker and their approach to community health workers, and then we'll have time for some questions at the end. Please do the next slide. So who are Telehealth Rocks? Some of you have been in other echoes and are involved with us or work with us and are actually part of the network. So Telehealth Rocks, which stands for Regional Outreach for Communities, Kids, and Schools, is a partnership across government and communities and school districts. You can see kind of the list here. It is fully funded by the U.S. government, by the U.S. Department of Health and Human Services. We have funding from the Health Resources and Services Administration, Substance Abuse and Mental Health Services Administration, as well as the National Institutes of Health for Health. We work very closely with state governments, both in Kansas and Missouri, and have official partners across Kansas State Department of Education, the Department for Aging and Disability Services, the Department of Health and Environment, and the Department for Children and Families. We also work closely with Missouri Department of Elementary and Secondary Education, as well as with Missouri Department of Health and Senior Services. We work with advocacy organizations, and most importantly, we work with school districts and education organizations across Kansas and Missouri. We are about behavioral health services. We are behavioral pediatrics at KU Med. That's who I work for. And then we also work with local entities and work a lot on areas, things like juvenile justice, kids at risk of justice involvement, kids at risk of child welfare involvement. And we're just going to keep adding everyone until we really impact everything that impacts kids through working in our communities and our schools. Next slide, please. So how did I think we went backwards. There we go. So why are all these people working together? Why do we have sort of this network of entities working together? It's because we really believe that we can create schools and communities where every child and family has the resources and skills they need to have the exact same opportunity for success. And how we're going to do that is we're going to transform our communities through comprehensive and integrated approaches. And a lot of what you're going to hear about today with community health workers is exactly that. We really want to amplify and coordinate existing resources and really come up with new solutions like school-based community health workers to meet the needs of kids and their families. So that's why we're up to what we're doing. And that's where school-based community health workers come in. Next slide, please. So this is our collaborative work. We provide clinical services, trainings like today, prevention services. We work with engagement and family support. Next slide, please. And so when we think about why school-based community health workers, it's because we talk in healthcare about the social determinants of health, but they're very much also the social determinants of education success, right? Both access and quality of education, access to healthcare. I started my career, or at some point in my career, started putting medical care into schools, and then started putting therapists into schools, and then eventually said we really need to look at community health workers, and all these things that get in the way of a kid's education and a kid's success are what we're working on. Things like economic needs, social and community context, neighborhood and built environment. So school-based community health workers can focus on these needs and maintain and develop school, community, and family relationships and resources. Next slide, please. So just talking from an education perspective a little bit, when we talk about the base of the multi-tiered systems of support pyramid, we see family school community partnerships as being that base. And this is what we're talking about today, and this is what we're up to today. This is what school-based community health workers can really be an important component of in a school. Next slide. So thinking about the family school community partnerships, you can kind of see the pyramid of what a community health worker works on. Things like training and support and supporting linkage to social services and education, collaboration in the community, other type of child reform, help communicate between the different organizations and programs that work with kids, and then of course increase access to healthcare and other needed services. Next slide, please. So I'm going to pass off to Aaron and Megan. Just wanted to give a little bit of a background before we talk a little bit about their highly successful program and how it's really transformed both their school, but also just their work on these types of issues and not just the community health workers, how it's really transformed that community. So Aaron and Megan, please go ahead.
Hey, thank you so much. And before we get started, a special thank you to those of you guys who work in a school district, because I realize that on top of this webinar, you also have standardized testing and student behavior and graduations and 1,000 other things on your to-do list. And so we do feel honored and very appreciative for you guys to take a little bit of your time out to hear about something that we really, really care about and believe is beneficial. So before we get too deep into it, just a quick little tidbit about why us and who are we, because if you're like me, when you're listening to somebody, you always kind of compare your world to their world to see if there's some correlation. So a little bit about us that you can see on the screen there. Our district's about 1,900 students. We have 4 school buildings and a career center. Free and reduced lunch is around 50%. And as a city, about 5,000 people. We're situated between the Lake of the Ozarks and Jefferson City. And we have a lot of in and out. So housing in it is an issue. Affordable living situations is a tough one for us. And we have a lot of families that move in and out of our community. Okay. So to start with, this isn't one of those things where I'm going to say we've always been a shining star. In 2008, for lack of better terms, we were kind of awful. We were in a struggling place. So obviously there was a downturn in the economy in 2008. We were hit pretty hard. We had 2 factories and a car dealership leave in the same year. We had a very, very large teacher turnover. There was inconsistency with our administration. And then academically, we were not where we should be. We were 450th, approximately, out of 550 school districts in our state. And the community support just wasn't there. We had a lot of people who doubted leadership and doubted our direction. And so we really knew that we either had to accept that or we had to say, no, we want better for our community. And so we just started working really hard. And I say we because most of us in our leadership team, a lot of us as educators, have committed to this is our home. We are not leaving here. We're going to make our community better. And so it really took on a we mindset. So, Christy, if you will. So then to now, we're in a much, much better place. Industry has come back into our community. There's a new factory that opened up locally that, to be quite honest, wasn't even considering us as an option. We were kind of a flyover option that they were just doing a courtesy to look at, and now they're planning on having 1,000 employees in our community. The teacher turnover will be, out of 300 and some employees, will be under 15 teachers in turnover, and some of those are retirements. Our most recent MSIP put us at 24th in the state. Academically, we're in the top 100 in every area, give or take. I mean, some bad years, but in common years, it's over 100th in the state. And with a lot of our content, we're over 50th in the state. And our last bond issue passed with 85% approval. I bring those things up not to be look at us, but more look at where we've come from. And I think that while the CHWs weren't the entire catalyst for that, I think the mindset shift of it's not just about our state scores, it's not just about our attendance rate, it's not just about our graduation rate, it's about everything combined. And the only way that we can get to the places we want to be is by taking like a grassroots dig in approach of we're just going to love every kid and care about everything that's in their world. And a CHW is so at the core of that kind of mindset. All right, Christine. And I have to apologize if you hear the announcements in the background. We are a school. So then how did we get to CHWs? So this all actually kind of started through conversations with Robert when he was in a previous role at Central Ozarks Medical Center. And it really started with us saying, we have so many kids with so many different needs. My background was school counseling. I would go home every night thinking, how can I get this kid this or that? Or I would go home thinking, why isn't some other agency doing that? Who's the person out there that's supposed to help these kids? And then we got to a point of thinking, why don't we just do it? Like, why are we looking for somebody else to save the day? Why don't we just step into these kids' lives and be more a part of everything? And so Robert and our district had lots of conversations about what that would look like. He introduced the concept of CHWs through Central Ozarks Medical Center. We started partnering with them. That came into our district. We started going down that path of looking at therapists in the district. We have a nurse practitioner now that works in our district. We have a dental office in our district because we just believe that the more that we can do wraparound care for every kid, all that's left is their ability to engage in the academics and grow and learn. And they're also going to gain soft skills, which makes them better employees. And that further grows our community because we have less turnover in the jobs that are here in our hometown. And so the who's doing this job in our district, we have 3 CHWs and they look pretty different. So Megan Opie has been the longest CHW around. She's done this job since day one. And then her role is really looking at the immediate needs of kids and then some other things like Medicaid care. Well, and she's going to do a better job of explaining some of this, but looking at making sure they have the insurance and the things that they need on a day-to-day basis. We have another CHW who does a lot of focus on attendance. So she's helping the principals, the administration in general, the secretaries track down, why are we seeing kids gone? What's the barrier? What's the thing? Let me go to the home. And then we have a third CHW who's working primarily with behavior. And she's pulling kids and working very intensively with kids who, to be quite honest, disrupt their learning environment and the learning environments of others. And so the why for those things is because that's what we said is our biggest problem. And I think we're going to get to that with every school should be catering this to what's the thing you're pulling your hair out. And I realize I don't have any hair to pull out, but what are you pulling your hair out every day and thinking we've got to address this? Well, this is a way you address that. So we'll let Megan talk sort of about more of the nuts and bolts.
So a little bit of background for me is I was a teacher in this district for 10 years prior to becoming a CHW. And I also do Missouri First Step. So I was going into homes and working very directly with families in their home environment. And as a teacher, and for all teachers that are on here, when you're in your classroom with your kids, you think, I know how they live. I know what their life is like. But I really didn't until I was in the home and I could see the lack of resources, the barriers for the families. And it just really opened my eyes as to why there were behavior issues and different things. And so I was constantly telling Mr. Davis, our superintendent, we need social workers. Every building needs a social worker. And, he kind of pushed me off. And then one day when they called and they were like, okay, well, we have this role that's a CHW and we think you'd be a great fit for it. And so I came in and the role was very abstract. It was help kids get what they need with no money. And so I was like, okay. So I just started going out into the community. I started going to different organizations, Lions, Elks, Rotary, and just talking about what we do for kids.
And even industry. Those people work in industry, and then they go to some of those meetings. And so you're pulling in community members who want to donate and want to help.
And when I first started, it was just the basics. Let's get kids shoes. Let's make sure they have clothing. Let's make sure they have a buddy pack on the weekend. Let's make sure those immediate needs are met so that they can come in and sit in the classroom and learn without the bottom of their shoe falling off and things like that. And then it's just escalated to kids that are involved are more successful. Let's make sure kids can do any activity that they want to do in our district that maybe their parents can't afford. And then let's really wrap our arms around the families and guide them to those resources. Let's make sure that they have food stamps. Let's make sure that they all have Medicaid. So it's such a gamut of different things that we do, but really just what does the kid need to be successful? And let's do it. And let's find that resource. And so just an example, yesterday, our Masonic Lodge posted they're having a golf tournament to help kids that are not on free and reduced lunch, but fall kind of in that gap of having high lunch balances. Let's have a golf tournament, and we're going to use that money to pay off some lunch balances for those kids. We didn't ask them to do that. It's just what has evolved in our community. People have a bleeding heart for kids. They want to help, and it's just changed the whole mindset of the school and Eldon as a whole.
And honestly, as far as the benefit, that is such a large question in that to the kids, there's a massive benefit. To the community, there's a massive benefit. And one of the pushbacks we got early on was, well, you're just handing things to people and they're not going to learn that you've got to work for it. But there's a learning piece inherent in this of if you're facing an issue, here are the ways that you can approach that. Here are the options you have. Here are the ways that you can be proactive instead of reactive. And we believe that the people that we're working with and helping on the long term are going to go and seek solutions rather than hope somebody just hands them something. And I believe we've seen that.
And then to know when I was a teacher, to be able to manage your classroom and teach the lessons you need and cover the curriculum, to have somebody to be that support for those teachers is amazing. And even if it's just a listening ear, hey, I've got a kid going through this, help me work through it. And just taking some of that burden off of their shoulders has probably been one of my favorite parts of the job, because you just see the relief that they're like, someone can help. And it just, when we first started out, I just made myself known in the cafeteria, eating with kids, going into classrooms, just kind of hanging out. And pretty soon the referrals just started rolling in. And we went from there. What does our day look like? Every day is completely different. Some mornings we're getting texts at 7:15 that say, so-and-so missed the bus. Could you go out and pick them up? Sure. Some days it's a little bit quieter and we can just hang out and eat lunch in the lunchroom, or, read a book with a kid, or hang out in the office and offer support to even staff. So every day looks different.
Or they organized a prom dress event that gave out.
We gave out 72 dresses so far for prom this year for Eldon and surrounding communities.
And the part that I love is that my daughter is one of those kiddos, because these things aren't for poverty. They're for our kids. And when everybody can do it, there's no shame in anybody doing it. But those things take a lot of time and effort. And so even in that downtime, there's still things to organize.
Something that Robert said from the beginning was, if every kid knows you, then you're not singling out kids whenever you work with them. You're not walking down the hall and they're like, oh, Megan is, and I have kids call me Megan. I have kids call me Mrs. Opie. Oh, Megan's talking to that kid. They must need something. No, because I talk to everybody, whether it be the captain of the football team to, the star of the basketball team, to everybody. And so I'm just another, Christy too, our other CHW, we're just another person here that's here to offer support.
Yeah. Okay. Sorry to interject, but I did another thing that I think is really important is that the school-based CHW, and Eldon has the school clinic, right? They have a nurse practitioner, they have a dentist, they have therapists. They've had therapists for longer than they've had Megan, but
Mhm.
a school-based CHW should be integrated into the educational environment. They should coordinate with the school services, the school clinic, but they need to be part of that education team. That I think is a key thing. They should be in the hallways. They should know the teachers. They should be part of that education team, because that's how you're able to extend everybody through, having this person available, but also understanding and knowing what's going on in the school. So, sorry, didn't
Yeah.
mean to reject that, but I just think it's really crucial that we often think of CHWs as being a healthcare type of entity, but they can improve health, improve health through being really strongly part of that education process. So, sorry to interrupt.
No, you're fine. And to that point, we don't question that the reading interventionists are walking the halls. We don't question that or our recovery room teacher is there. These are all resources to help students who have a moment of struggle. That's it. And so if they're not in the building, if they're not walking, they seem like detrimental things or like a punishment for a kiddo. If you make everything normal, then it's all just normal. And that's the goal. So, all right, Christy.
And we do have a
And
question while Christy's moving forward. Pamela Thompson asked, how did you introduce, or how do you introduce the program to families in the school? Like,
To
how do you keep
families.
them? Yeah, how do you, like, when Megan reaches out to a family because somebody may have noticed something, or to see if they need help or if there's something they can do, or even how did you let families know that this community health worker was in the school?
So we didn't do a giant rollout of, hey, everybody, in an email blast. We just talked to each person. I mean, we informed our staff, and we informed staff, if you need to talk to a family, you can refer them to Megan, you can pass them her way. But most of this is just communication.
For the most part, I just, I call, and a lot of times because sometimes they may not know community health worker or community school advocate or whatever, the title is. And I just say, I'm a person here to offer you resources. And for some, as you know, parents, the school can be a threat,
Mhm.
especially if they've had interaction with Children's Division and different entities. And so what I've seen is sometimes we're a little bit of a breath of fresh air because we're somebody new. We can always offer them something. And so
Mhm.
I think that, for the most part, they're very accepting. Do we get a little pushback? Sometimes. I mean, sometimes we have to have hard conversations with parents. Sometimes Children's Division maybe does have to get involved, and there might be some pushback. But for the most part, every parent loves their child and they want what's best for them.
Mhm.
And so if there's a resource or a benefit to us helping them, they're on board.
Yeah. I mean, there was probably an article in the newspaper, a couple Facebook posts about some good things that were happening, but there wasn't like a grand reveal of this program. It just started. We just started doing it, and then things spread. All right, Christy. So we kind of hit on a couple of these about the being ingrained in the school and community. The people who work for Central Ozarks Medical Center that are placed in our building, we make sure they are part of our like PLC meetings. We make sure that they're wearing Mustang shirts on Fridays, like everybody. Megan organizes the tailgate for Friday night football. You have to have people in your walls being part of your culture, or else it doesn't work as well as it should. Um, and so you've got to have them there for the people to know them so that they can leave that place and the people still feel comfortable with them. Do you want to talk about your role with home visits and community
Sure.
agencies?
So we try to sit in on as many community agency meetings as we can. We try to have a monthly meeting with Children's Division and just sit down and talk about how we can better assist families, just what their resources are as well. We go to our LIHEAP meetings, which are, utility assistance. We try to be a part of every entity we can so that they know we're around. We get referrals for kids not only from our administrators and our teachers, but even from community members. Hey, I was at McDonald's and I saw this kiddo, and they'll describe what they look like. And 9 times out of 10, I'm going to know who they are. And they're going to say, I was just really worried because he, didn't have shoes on, or he, something along those lines. It's just become a whole community thing. And we do home visits for attendance. We'll just, go knock on the door and say, hey, Sally hasn't been at school for a while. Is there something we can do to help? Does she need a medical appointment? We go pick up kids for school if they miss the bus. We sometimes take them home if we need to. We transport for medical and dental appointments if that's beneficial for kids. Just pretty much anything that makes it easier for the families. We're a factory community. So if parents miss a day, 2 days, they get check marks, and so many check marks and you're out of a job. And so we know that that doesn't benefit the family. So like our medical clinic, our dental clinic, that has helped so much with parents maintaining employment and not missing work.
Mm-hmm. And people ask us all the time, like, how did you get to that? And the truth is, going back to the communication with Robert in his previous role and how that all worked, and then continuing with him, but it's just having a problem-solving mindset. And when I talk about like the culture change of 2008 to today, it isn't that if there's a problem with a kid, you call Megan. It's that she's a part of that team. But this has created more and more of our staff members thinking, well, we could probably do something about that. We could be creative. We could be a little bit more innovative. And Megan is a huge advocate or asset to those situations, but it hasn't become Megan deals with the kids who are struggling. It's Megan's a part of helping through that process, and she may do the bulk of the heavy lifting, but it's also people feeling empowered to do their own creative things. The administration's time, if there are any administrators on this call, this is one where if you talk to most administrators, they wish they could be in classrooms doing observations more. They wish they could be working on curriculum more. They wish they could be working on really the structure of schools or really communicating with kids and connecting with kids. But oftentimes we're tied up with so many other, honestly, issues. And so having a CHW that you can trust and hand something to let them go run with it is massive in saving your time, as well as the teacher burnout. If you look at most teachers, they're thinking about like, how do I use my meager salary to help this family? How do I, Robert's talked about his mom wrapping presents for all the kids in her room, and and struggling to make all that work out financially. And our teachers are no different than that. And so to be able to say there's a resource for you to reach out to helps them immensely. All right, Christy.
So we have a couple of questions that I'm going to bring up as we move to the next. I think you're ready for the next slide. Is that right?
Yeah, but go ahead.
So first one is, do you have school social workers as well as CHWs? I don't believe you do, but we can talk. I'll talk a little bit about that. If you have something to say first, please go ahead.
No, go ahead. Go ahead.
Well, so we do have districts, like I said, we're working with multiple, especially we're in Southeast Kansas. We're just kind of moving back to Missouri, working with the South Callaway and Kennett school districts. School social workers are incredibly important. And I would love for every school district to have a school social worker, just like every district should have a school counselor and others. A CHW can be someone that can do sort of that long-term intensive type of work that often a school social worker doesn't have the space for. And in a high need district, just like you need a teacher, but you may have classrooms that need a para, you need other resources in addition. So you can, absolutely, school social workers and community health workers can be really strong partners and advocates. And, it's just really kind of doing similar things, but often the school social worker is working on so many different issues with so many different kids, but also has a higher level of expertise. So I come from a healthcare environment. I was former CEO of Central Reserve Medical Center and FQHCs. We talk about people working at the highest level of their certification. So when it comes to school social workers and CHWs, I think it's an area of opportunity for everybody to work at the highest level of their certification, because there are things that school social workers and people from a social background can do. And there are things that community health workers are good at and can do. There are different types of work, but they're compatible work. So that's kind of my thought on that.
I would agree. And so in the past, we did have a social worker, and personnel wise, it just didn't work out. That person wanted to do something else. Staffing wise, we felt the most comfortable with this model. So we're giving you our blueprint, not the blueprint. I know that there are going to be districts who have a social worker who helps oversee CHWs or schools that opt for social workers. Because if you're a social worker on this call, you're probably thinking, yeah, I know this is what I do. Teachers and paras oftentimes have very similar roles, look really similar. A co-teacher, and this is a broad net that's going to have a lot of overlap. For us, this has been a model that's been really effective. I think every school has got to cater it to what fits them the best and what the issues they face.
And then the next question is this position a community health center or school district employee? I'll let you
Yeah.
answer that, but we can talk about across the districts that we work with. I'll just start by saying some are employed by federally qualified health centers, some are employed by community mental health centers, and some are employed by school districts themselves. But I'll let you answer for your district.
Yeah, I mean, and that is our answer. Megan works for Central Ozarks Medical Center. We have 2 CHWs that are employed through our school district that are grant funded. And we could also just hire somebody out of our everyday budget. So I think it can look different depending on what resources you have, what communication, what partnerships you have. But it works in all of those areas. It doesn't matter who's signing the paycheck. They can still do the same things and do them really effectively.
And I'm going to pass on an accolade before we move on. Jennifer Hunter said my son graduated from Eldon in 2008. I saw firsthand how one CHW made all the difference in so many students' lives, but also improved the community. So there's a voice from Eldon. If those of you, Eldon is just close enough to Jeff City that you'd be amazed who lives in or graduated from Eldon.
And then I always feel bad talking about, hey, we were kind of rough, but that is something that you have to own what you are and be proud of where you're going. So, okay, Christy, if you want to move on to the next one. We'll just kind of jump back and forth on these. So how do you pay them? That's kind of what I brought up earlier, that, we have different pay backgrounds on our CHWs. Obviously grants are always ideal for schools. And I'm going to say this, and this, I hope I don't touch any nerves. Schools have to make decisions on where they see the best, benefit for their money. And so there are schools who are very heavy into instructional coaches. There are schools who are very heavy into low class sizes. Everybody's got to make decisions of what is the best thing for their culture and their staff. This is something that we believe is beneficial. Now, we've been very lucky in our partnerships and in grant funding, but I believe that even if those things didn't exist, because we've kind of dipped our toe in the water, we were ready to plunge. And so no matter what, it's something that we believe is beneficial to our district. And so, every superintendent would probably look at this a little bit differently, but I think it's definitely money well spent. And as far as like what salary base, we look at sort of teacher salary when we're looking at those things. Certifications.
You can attend a community health worker program. I did through OTC in Springfield, Missouri, and you can get, and then you're accredited also. But there are no degree requirements. The 3 of us look very different in our degrees. I have a master's degree, others don't. And so it just kind of depends on more so who is the best fit for the job. And going back to that, being totally in your community. My husband owns a business here, and so we are not leaving. This is my home until forever. And so just jumping in and making it be the best you can be. And I think that's important to have that mindset. Eldon is not just it's not just a stop for me. This is where I'm at. This is where I will retire. This is where I raised my kids. This is where I hope my kids come back to. And so more so, just being vested in your community over certifications and degrees.
Yep.
And I did want to point out, because people ask this one a lot, if you're wanting to hire a CHW, it is very, very common to hire someone who's not yet certified, hasn't done the training course, which is offered by universities, community colleges, technical colleges, universities across across the state of Missouri, and then in Kansas is offered through Wichita State. It tends to happen that you hire someone, and then at the next opportunity, they go through the class. That's what Megan did. She was employed by me at the time, so I can say that. So she worked in Eldon, and then that next spring, she went through the OTC program. We really are strong believers that community health workers should be trained and certified, go through the process. We also believe that there are some components, and we're working on sort of materials related to how do you support CHW in a school environment, because there are things about schools that are needed to know. And, I always describe it as you can be an RN, and a school nurse should be an RN or should be a nurse. And their training is very important. But every summer, the State School Nursing Association has a boot camp for how to be a school nurse for someone who's been a nurse, but now they're in a school district because of responsibilities and needs and requirements. It's just different in a school setting. So anyway, I'm sorry, I keep jumping in. I hope that's okay.
No,
You're
please
fine.
do.
You're fine. It is one of our, you always go back to culture. One of our beliefs is you hire the person, not the resume. It doesn't make the resume unimportant, but we are always looking for what are our areas that we've got to grow in, and who are the people who most, have the background or the heart to address those things. And so that's just something that's important to us. And you're right. You need to have some training. You need to have the background, but you've got to also be the right person. The money for helping kids is always the hardest one. And I shouldn't say the hardest. It's one of the hardest ones. That has been so much legwork from Megan at going out into the community and just sharing the mission, sharing the vision, talking about our kids, giving those stories. People want to help you. If we didn't have $1 for it, though, you can still do the job and help people connect to community resources that you don't control. So even if she didn't have any donations, and I will own that we have been very, very lucky that people have been generous with us. So this is something that she could still take people to understand, what food stamp process is, WIC, Medicaid, like helping them through the process that still gets them some of the places they need to go.
Yeah, just getting out and learning all of your resources. I use Ministerial Alliance a ton. Different church organizations in our community are willing to help. Health department has been a huge resource for me. So they do a lot of our buddy pack funding. I write grants to our local Rotaries and ask for funds that way. Even we write a grant for pants, which sounds crazy, but our elementary, South and upper kids go through a lot of pants during the year. And so we write $1,000 grant for pants and go out and buy elastic waist pants. If you're in an elementary school, you know how important that is. But I write a grant to the Dental Association, and they give toothbrushes and toothpaste and dental floss at our back to school fair. And so just really seeking out that different funding. I have a group of retired teachers who give us money to help kids do things. So to get band instruments, to get football cleats, to be able to go on school trips, be a part of the FFA, that sort of thing. But just seeking out and getting the word out. People want to help kids.
Yeah, and you get creative. We have a career center, which means if we've got a student or a family who have a car issue, we can work on it. We can do that. You've probably got a parent in your district that works for Walmart or Target. I'll bet they will tell you when something's been marked down to 99 cents and help you get there real quick so that you can get 50 of them. Those are the people that you have to reach out to. We don't have a lot of families that don't offer to help, but to be quite honest, nobody's held hostage. If you don't want the support, that's okay. We don't strong arm people. We just want to be there to provide support for them. And then as far as those last two, the who supervises, so I'm the director of special programs. So that's like special education, homeless, homebound, 504s, just all the umbrella stuff. But the reality is we have to give our CHWs a lot of leeway to make decisions, and I don't micromanage them at all. There are very long stretches where I don't see Megan, and I just trust that what she's doing is the right thing, and because it always is. Same with Christy, same with Annie, our other CHWs. And so I don't want to know what every hour they're doing is. That's too much, and they couldn't be as on the fly and successful as they are.
And how do we track success? So Aaron and I sometimes say that this is rocking chair work, and we may not see, all of our success until we're a little bit older, and it's these kids who come to school and we see changes and some of those breaks in generational poverty. And if you work in poverty, you know that it is some of the hardest work to change mindset, to change behaviors. And but some of the success that we see is so exciting, and it's a lot of stories. I think the success of our district is shown through some of our numbers and that sort of data, but When I first started, the first kiddo that I ever worked with literally lived in a shack 2.5 miles back in a trailer park. He was not going to make it, him or his sister. I mean, it was constant absences, just they never had food. They had head lice like you would not believe. When I first started, I spent hours combing out this girl's hair from lice. And just everyone really wrapped their arms around this kid, both of these kids, coaches. He is going to leave on July 22nd to go to the military. And in San Francisco, he's going to basic training. And so while it wasn't just like such a success story like this, it was like this. And we had a couple of times where I was like, I failed him. I failed, he's not going to make it. And just to see those things, like that kiddo is going to go, he's going to go to San Francisco. He's going to do amazing things in the military. He wants to come back someday and be a coach here in our district and teach kids and coach football. And, you just see some of that, and it really warms your heart to see success.
And there are hard days. So I will tell on Megan a smidge. There was a girl that we poured tons of energy into, and Megan came to my office one day, not long ago, crying about, I don't think I'm any good at this. What am I even doing? She's pregnant. Everything we've done is just, and that is a hard one where you're like, so what were we doing? How, did this work? And now she's a teacher in a neighboring district. And you're like, it is so up and down and 2 steps forward and 3 steps back, but the end goal is still worth the fight. But if you measure in quantifiable things, you'll probably feel like you've not done a good enough job. If you're measuring the quality of things, then you're going to see the successes. Okay.
And I just wanted to put in, my mom was for 58 years, a first grade teacher in a very poor district. And a lot of this work is motivated from the idea that we used to go to the Walmart in the small town near where that school district was, and she would see teen parents with kids clearly living in poverty saying, Mrs. Stiles, and my mom had them in first grade. And she would say, as they walked away, they never had a chance. I could tell in first grade that they would not have a chance. And this is about giving kids a chance. We're not saying you're successful with every kid, but every child deserves the opportunity for success. So we have a lot of great comments, some really great stuff about community health workers in Kansas and the training process. And of course, both states have very strong CHW coalitions and associations. We did have one question from Kelly Moffitt, who works with a hospital in Phillips County, Kansas. And she's working to become more involved with assisting teachers with addressing inequities for students, and just any suggestions on how to integrate and move forward. I think it's really exciting to see a hospital-based CHW, working to meet needs and wanting to support school districts and kids in the community. But any ideas?
I mean, this is going to sound like the easiest answer in the world. Go to the school and start doing it. Just be present. Like, educators are in a silo. You have kids who come into your room, and that is your world, and you're thinking about their little lives, and some of their very big lives. Administrators, we're not used to people coming in and saying, "Can I help?" So, like, I'll be very honest. When Robert first started talking with us, we were like, "Yeah, okay, but like, what's the next part?
Catch?
What's the next part that we need to talk about?" Because you don't just get stuff, and people don't always just want to come in and help you, and so. As simple as this sounds, I think going into somebody and being earnest and saying, there's a thing that I can do for you, and make relationships with the support, the counselors, the paras, the school nurses, those people who are always racking their brain for what else can I do? And more than likely, they're going to say yes and take you up on that. And I think those have to be human interactions. I get things all the time that are emailed to me that are just like a cold call of, hey, you should use our curriculum, and you kind of move on from it. But when you have a conversation with somebody face to face and they say, I care about kids, and especially the kids that are in your building, and I want to be part of their story, you're more than likely to say, yeah, if you're going to do it, I'll take you up on it, and let's go. And so start by bridging that gap. Go there, talk to them.
All right, I'll let you go forward. We do have a couple other questions, but I'll save those
Yeah.
to kind of
Christy,
finish up. I know you have some other things to get through.
Well, I was gonna say, Christy, if you want to jump forward, I think we're about to the end point there. So for us, those are the three takeaways. That if you want to be a successful CHW, you've got to be in the buildings, you've got to be in their lives, you've got to be in the teachers' lives, you have to be present. I think working out of a separate building or a separate office or whatever, it's the same thing. If you want to be a good administrator, stand in the halls at every hall passing, because your kids need to see you. And so I think the more present you can be, the better. Your school is your school. What we do is great for us, but it may not be great for everybody. But you've got to take a very internal look at what are the things that we've got to address. And if we weren't so hamstrung by, time or our own hangups, what would we do to address that? What do I wish? Then that's the why not mindset of let's just go do it. And then the last one's the creativity. And I think that's where Megan's the best, that she just steps in and gets creative and, makes a relationship with the exterminator in town. So they get a nice discount when they have to go do a bug treatment.
Yeah, this class of graduating seniors was the first class that I worked with 7 years ago when I came in. They're like, I feel like I was most ingrained with this group, and I could tell story after story of, just simple things. A girl yesterday, she's been a girl that's walked around her hallways with her head hung down, a hood up, just very sad all of the time. And we've kind of wrapped our arms around her with therapy and with our resources, and took her to get a prom dress, and she's going and she's excited and she is, just ecstatic to participate in prom and graduation, all those things. She was not there 2 or 3 years ago. She is in a totally different place. And I feel not just with my resources, but everyone just wrapping their arms around those kids, and just really neat to see and there are frustrations, but just some really great success stories and kids that are in a much better place because we kind of stepped back and looked at what do they need first before they can sit down in a classroom and learn.
And you've got to share those. We get overwhelmed by struggle in education. You're tired all the time. It's April. April's hard. We're all tired. You need to be telling teachers like, hey, this little victory happened, Okay, sorry. We're taking up a lot of time.
No, you're doing great. The only other thing I would say is, it's not about a person. You can't put a Megan in a school, no matter how amazing she is, unless you are also about changing your community. This is a school-based community change program. It's so interesting because from school districts, they often say, I don't know how to get the community to support us more. But what I hear from the community over and over is, I don't know how to support the school. I don't know how to get into the school. I don't know how to talk to the school. I don't know what the school needs. So having somebody, whether it's with families, which is another great idea, community health workers, I often talk about that they're not, yes, they should be integrated into the school and working with the education team, but they should be on the side of the family, the side of the parent. Community health workers are about rebalancing the system. And I'm sure time and time again, Megan has found ways that the school inadvertently or the community inadvertently isn't helping families be successful, and she can advocate for that change. And so it's just really important that this is someone who can be part of the community, part of the school, on the side of the families, and working with the school. So
and so we want to answer your questions, but I will tell you, genuine offer, our emails are on here, our phone numbers are on our school's website. Email us or call us with questions. Like, anything that we can do to help all kids is part of our mission. So feel free to reach out to us if there are questions that we don't get to.
And Peggy Gaddy, so moving into the questions, I think we're ready. I'm just going to go through the questions in the chat. Peggy asked about working with DESE, Missouri School Boards Association, Missouri Association of Rural Educators. We're really fortunate that we have in Kansas a very strong relationship with the Kansas Department of Education, as well as with the Kansas Department of Health and Environment, which works with community health workers and oversees that side of things. And the same way, we are really pleased to be a co-grantee alongside Missouri Department of Elementary and Secondary Education. They have the Advancing Wellness and Resiliency in Education grant for the state of Missouri, and Telehealth Rocks itself has that grant for Kansas. And so we've gotten to know some people at DESE incredibly well. And it's also another benefit of Eldon, Lisa Deerking, who and so many different people in the Department of Elementary and Secondary Education actually have an affiliation with Eldon from their past or current. So this is a start. We know that there's more work to be done in getting the word out. We feel like it's grown substantially. For very, very many years, the only school district that really had this type of school-based community health worker. I know we have an asthma CHW on the call that's in a school. But Eldon was the one, the only one. And then I went to Kansas, and now we're working with 9 school districts in Southeast Kansas, and we're working with other school districts in Missouri. But I believe that this is an important thing. And I will let Aaron and Megan say anything about kind of people or education department or school board association, any work or information that you've ever done with them.
I mean, like any other school district or whatever, collaboration is such a key. And so, DESE is one of those places that I just reach out to with questions or thoughts or whatever. And, I just kind of talk to everybody like they're my friend, and I assume they'll be my friend. I think that they're looking for good ideas too, or are happy to give guidance. And, you talk about Lisa or anybody else there. The worst you can hear is, yeah, I don't know that you guys are supposed to do that. And then you kind of retool and figure some new things out. But, they've always been super positive and supportive. And, I don't know. I've never thought about any roadblocks with DESE or MSBA or anybody else.
I would say we have the same type of relationship. Trish Bachman at Kansas Department of Education is, right in there in our meetings, part of what we do. The State Department of Education is a partner in Telehealth Rocks. And then we're so pleased by our partnership with the Mental Health Intervention Teams program at KSDE as well, because that's such an important program. And the making mental health services available in schools and having those teams in schools is, there are districts where we have the most success right now. Our districts where the MHIT program is very active, districts like Fort Scott, along with having strong CHWs in the schools. And so there's enough room for everybody. It's going to take everybody. We talk a lot about having a big tent. We believe everybody has to be at the table. We have to coordinate everything with everyone, because it's going to take everything to really accomplish this for kids. So we have a few minutes. I don't know if anybody wants to unmute and have any questions, or we can kind of move on to some questions we've come up with. Do people have any questions that they want to unmute and ask? All right, well, let's move on to the next one. We'll just see what kind of is left to talk about. So we talked a little bit about the different ways you can use CHWs, but Aaron, I thought it'd be interesting to talk about where your other 2 CHWs came from and how you identified them, and then we'll let Peggy Gaddy ask her question.
Yeah. So our other 2 CHWs, one was a secretary and one was a para. And again, it comes down to when we're looking at having another CHW, you start thinking about attendance is something we've got to address. Well, that secretary had made phone calls to everybody. She had worked for MOCA. She'd done home visits with us in the past. So you're just like, well, that's kind of a no-brainer. And then for the para, that Annie, who's now a CHW, I'm over special education. I watched her work with students who struggled and be really creative and come up with different ideas that I was like, I wouldn't have been that good. I wouldn't have thought of doing that. And so you just try to raise people's skills to a level that help more than they were able to do before. And so that's how we identified those people. And then we encourage them, like, this is probably something you should think about. So there you go. Go ahead, Peggy.
Yeah, Peggy Gaddy. And we can't see if others have raised their hands. You might just want to unmute after Peggy, because I may not be able to see all the raised hands if it's not on my screen.
Hi, this is Peggy, and I'm with the Missouri Asthma Program. And I guess my question when I was asking about sharing information with DESE and MSBA and Mayor was, is there a forum that the schools can share these ideas? You have such great ideas about working with the community and getting mini grants and things like that. And I just know that when a community of schools can talk to each other, I think they learn from each other. And again, these ideas are so great. And it's not a lot of money, $1,000, 500 here, but when you're talking about pants for the first graders, I just think if there was a forum where you all could share information with each other, I just think that would generate a lot more ideas in communities and other ways to help the kids. And that was kind of what I was asking about with DESE and MSBA.
Yeah, great question. And I'm going to probably get this wrong, and I apologize. And if they're on the call, they'll correct me. But Melissa Maris, who's amazing, by the way, if you ever have questions, she's somebody I would strongly suggest reaching out to. Lisa Deer King, and I'm gonna get one name that I've forgotten, and I feel bad. I know they have a routine open call over lunch where people can just call in to ask questions about things like this and have conversations on the Missouri side. It's just an open webinar where you can ask questions and go through all of this stuff and pick people's brains. So I do know that exists. I'm going to feel terrible that I don't know the exact details of it.
And I would also add, it's a lot of word of mouth. Every district we're in, I started with, well, in Eldon, because we were working there. But then when I came to Kansas, I had started the school clinic in Coffeyville. And so I said, hey, we're going to write this grant. Do you want a CHW? And the question was, what was that? We partnered with the FQHC I used to work for down in Southeast Kansas. And then from there, just other districts asked for it. And the same thing's happening in Missouri, where because districts have seen Eldon, Tipton is interested. Because they've seen Eldon, South Callaway is interested. Because I was already working with Kennett and had worked with Kennett for many years, started talking with Deb Cook, who is such a visionary. So yeah, a lot of times it's been word of mouth. Our hardest thing is we can only fund so many, we can only grow so fast. I mean, it has exploded. And I came here, we had about $100,000 in funding. We now have $2.8 million in funding a year. We're going as fast as we can. It's an important model. We believe it's also important to help state government and funding institutions and, kind of understand it. But it has, yes, Peggy Gaddy's right. Deb Cook is one of the best. And I won't, I felt like
Amanda Wogan's on this call, and she walked up to me at a conference and was like, how do you do that? And you just start partnering with people, and everything's easier when you're not alone. And so you just kick around ideas, and that's where it is. And Melissa commented on that about the call. So thank you, Melissa.
And I just we have 3 minutes left. So Aaron and Megan, just as we finish up, and thank you everyone for coming today. And you can always reach out. Our job, we are regional. We work in Missouri and Kansas. I will help you. We will help you. We will talk with you. We will walk through it. People, we want you to come to us, and you want to talk to Aaron, you can want to work with Eldon, hear from Eldon. This is all available to you. That's what this call is about today. But if you had one piece of advice for a school considering hiring a CHW, kind of finishing up, what would that be?
Make it about you. Make it about the right person with the right mentality and the right cause. Make it about your school district that's really addressing the stuff that
and make it fit you, but don't make it too hard.
Yeah.
We have a really relaxed referral process. I had job shadowers of CHWs from other districts where they had to fill out Form A, and then when they got to level 2, then they could make a referral to the CHW. No, teachers won't do that. They're too busy. If they have to fill out a form to get a resource from me, too much. Just, we make it very relaxed. We make it very easy and very accessible. And I think that is a big part of our success is it's not hard.
Yeah. Be a community, not an organization.
I agree.
Just talk to each other, support each other, and everything will come out.
And I'm going to pass off to Christy, who can finish this up. Thank you guys. Thank everyone so much for being here today. And reach out with your questions, please. We're here for you. That's what this is about.
For sure.
Well, thank you. I want to thank Megan and Aaron for joining us today to share. And we enjoyed learning about the innovative ways that you're including CHWs on the education team and in your school. It sounds like we're all taking a lot of different pieces and things away from it. So thank you for sharing today. We want to say thank you to everyone who joined us today. We would love your feedback on this webinar. There is a short survey in your inbox. It's very short. It's 15 questions. It should take 2 minutes or less. And we really do read responses and use them to implement changes. There have been some questions about follow-up materials. Yes, we will send follow-up materials to your email. They'll also be posted on the Telehealth Rocks website and Facebook page. Just give us a little bit of time to process that recording, and then we will send that out to you. And any questions, then you can send those to telehealthrocks@kumc.edu, and we will also email your certificates of attendance. So thank you
And
for joining us
One
today.
final
Oh,
thing,
go
we
ahead,
will be
Robert.
sending out, we created a 4-pager, Lisa Dierking at KSDE asked, Missouri Department of Education, sorry, asked for it. That's just kind of like, if you want to share this in your school with your principal, your superintendent, administration, you think it's a great idea, this is just a 4-pager that it's kind of like, why might you do a school CHW? So we'll include that as well. Hope everybody has a great day, getting you out of here on time. Hope to see you in other webinars and echoes to come.